credentials, you found Taruna. What do you recall about her initial visit or two, and how was it different, either in what you experienced or the effects on your symptoms, or both?
I don't remember the initial visit that well. The things I remember were you did manual work, like with your hands, and that's rare. Like I really liked, like, the previous McKenzie therapists that I've seen did not do manual work, and the ones that I've seen that are not Taruna, I have not done manual work. And I've benefited before from a lot of manual work, so I really liked that. I liked, obviously you do a lot of extension with McKenzie therapy, and I like that too. I felt like I could make progress doing more extension. And I just felt that this was a different approach, or that from what I've been doing, and we could really just attack the low back directly and those nerves. And I was like, I don't know if this is going to work out. It's possible that, the discs are, causing the pain and they're worn out, and I'm past the point where therapy can help me, even with the surgeries. But if anything's going to work, it's going to be this.
Mm-hmm. I see. Okay, so what do you recall was that turning point initially in care with Taruna that told you that, okay, I should be able to get, or I am getting more relief or more of recovery than I was getting before?
I mainly felt like my lower back was moving. Like that was sort of the big thing. I was the first month I was still really, really stiff. But after our sessions, I would just felt like I could move better, like the muscles felt a little bit better. And I slowly was able to sort of gain some strength back, and sort of like, okay, like I can work with this. The muscles are responding a little bit. The nerve pain is settling down a little bit. And from there, I guess I just sort of, I kept going. I'm not, through this whole process, I haven't been much of a, I think this is going to work, because I've done that a lot, and it's sort of like, I just keep my head down and do the exercise. I don't know, that's what I have to do.
You didn't want to set yourself up for disappointment.
No, because I sort of knew it was like, it's possible. Like, I don't, I've been in this for so long. I don't know what the issue is, but I like this. I can feel it moving. Movement is good. I'm going to do it. Yeah.
I understand.
Yeah.
Was there a relief to the nerve pain, the leg pain?
Yeah. Mm-hmm. Yeah.
Okay. And was there any one particular movement or direction, or what do you feel like has been the most significant element of what Taruna has done with you or for you or taught you that's relieved the leg pain? Or is there any one thing?
I don't know. I went through, like, I feel like I've done every exercise in the book, like, and I sort of, a lot of them have helped me. I don't think I have a main one, or if I have a main one for a couple weeks, it'll change the next couple weeks. But no, the biggest one was just, I think the manual therapy helped a lot. Consistent extension helped a lot. Yeah, I would think those are the main ones, I think. And just,
Okay.
getting my lumbar spine moving, it was really important.
Yeah, absolutely. All right, Taruna, will you help us understand from a clinical side of things, as you're seeing Simon, those first few visits, we all, those of us who are clinicians, understand that our focus is to identify what's the classification, the diagnosis from a mechanical standpoint. Help us understand what you saw, what you were thinking in your mind, your classification, and where your focus was in terms of what was most important early on.
Yeah, so his initial classification, he was, quite a few weeks post-surgery. So he wasn't just an active derangement, but also had quite a few symptoms of what comes under the syndrome of chronic pain. Because like he said, he's had that pain for so long, and just having that pain symptoms, that nerve, being under irritation for so long, changes some of the neurosensory pathways as well. So that was another aspect to tackle, in addition to the mechanical aspect of the pain. Yeah, so in terms of, getting back addressing the mechanical component of it, which is the derangement, by restoring the extension, getting the joints to end range, and then also addressing the chronic pain aspect of it, making sure we are retraining those neural pathways to function in a pain-free manner by gradually exposing him to activity, was the second part of his treatment. So it's always been in conjunction with both, combining the mechanical aspect of what we are treating with the chronicity of symptoms and the fact that they've been in his system for so long, exposing him to activities, making sure that they are not making the symptoms worse, was a big part of the program. I would say that would be different from what he had previously done.
Okay. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.